Herpes zoster involving the S1 dermatome. Definition. The culprit is the varicella zoster virus. Primary infection with this virus causes chickenpox, also known as varicella. At this time, the virus infects nerves, namely the dorsal root ganglia, where it remains latent lies low for years. It can then be reactivated to cause shingles with blisters over the distribution of the affected nerve, accompanied by often intense pain and itching. Herpes zoster is more frequent with increasing age.
Like we mentioned, shingles, or herpes zoster, is caused by the same virus as chickenpox. The virus tends to lie dormant, and once the individual's immune system is lowered or compromised, the virus works its way through the peripheral nervous system, and once on the skin, it forms into small vesicles or lesions and appears red and swollen along the nerve pathway. These lesions are located along the nerve fibers of the spinal ganglia. So basically, the virus hides in the nerves, and when the body's weak, it comes out to play. You can imagine a pathway it follows from the nerves to the skin, where it starts to wreak havoc. It makes a nasty looking rash that looks something like this. Not very pretty.
Now, application in medicine. A dermatome is an area of skin that is mainly supplied by a single spinal nerve. There are 8 cervical nerves. Note that C1 has no dermatome. There are 12 thoracic nerves, 5 nerves, and 5 sacral nerves. Each of these spinal nerves relays sensation from a particular region of the skin to the brain.
And have a little recap on dermatomes, but let's quickly run through what we'll be looking at in this tutorial. First, I want to start with the basics and have a little recap on an important group of structures known as the spinal nerves, which play an essential part in mapping out the innervation of the skin. We'll then move on to learn more about what dermatomes are, how they work, or perhaps why they don't always work, aspect of the spinal cord as it sits within the body and motor innervation to the trunk wall, head and neck, and of course our limbs. Most relevant to us today, of course, is their role in the inner spinal nerves.
This video is not over yet. Continue.
With the accessory and motor aspect of the spinal cord as it sits within the vertebral canal, with spinal nerves branching away from it. These spinal nerves course to all the peripheral regions of the body, providing both sensory and motor innervation to the trunk wall, head and neck, and of course our limbs. Most relevant to us today, of course, is their role in the innervation of the majority of the skin of the body, with the exception being certain areas of the face which are innervated by branches of the 5th cranial nerve, the trigeminal nerve. To refresh your memory, we have 8 cervical, 12 thoracic, 5 lumbar, and 5 sacral spinal nerves.
This video is not over yet. Continue.
Now for
Chris Shock. In this tutorial, we'll talk about therapeutic options for the very common reactivation of chickenpox known as herpes zoster, also known as shingles. So let's delve into the therapeutic options for herpes zoster. Again, it's also known as shingles, and it presents as a localized, painful, blistery rash. It does not cross the midline of the body. Well, if you have zoster, it's important to initiate early therapy. There are oral and intravenous or IV antivirals. Usually oral antivirals are treatment enough. There are a few cases where zoster may involve the ear or the eye, where intravenous or IV antivirals are recommended. Ocular involvement or disseminated zoster, that means is you have shingles or zoster and you're immune suppressed, and the rash isn't just confined to one region, it can spread over much of the body, kind of like chickenpox. That may require hospitalization because of the potential for internal involvement. Again, early therapy is important because it decreases the severity of the condition, and it also decreases the chance of developing what's called post-herpetic neuralgia, which means which is persistent shingles pain. That can last for months or in some cases years. What are we going to do about it? Well, antivirals. There are three main antivirals that we use. One is called acyclovir, one is valacyclovir, and one is famciclovir. Usually the treatments last for about 7 to 10 days, and these can all be taken orally. Prednisone in certain cases is recommended, but that's really only for cases where there is severe pain or where the eye is involved, or if the ear is involved, then prednisone is recommended. We think it might decrease some of the damage to the nerves in those very sensitive areas. Pain control is important because this can be excruciatingly painful in some cases. Sometimes oral narcotics are used to control the pain. Sometimes simply non-steroidal anti-inflammatories like ibuprofen or Tylenol can also be used. There's some pain modulating drugs such as gabapentin, pregabalin, or amitriptyline that can be used. These modulate the way our brains perceive the pain, and they're good for more long-term pain control in post-herpetic neuralgia. Zoster prevention, well, there is a vaccine known as Zostavax. It's a live attenuated virus, so that means it's the varicella virus, but it's a weakened form. The CDC recommends that all people aged 60 and over receive the Zostavax to prevent zoster. It's not given if you're on immune suppressives such as prednisone, cyclosporin, or anti-inflammatory drugs known as biologics. So if you're going to be placed on one of these drugs, your doctor may want to give you the Zostavax prior to initiating therapy on immune suppressive therapies. The Zostavax reduces your risk of developing shingles, herpes zoster by about 70%. Well, I hope you found this tutorial on zoster therapy helpful. As always, thank you for allowing us to participate in your care.
Now for the pros, we have that the shingles vaccine is the only way to reduce your risk of getting shingles. The vaccine is recommended for everyone ages 50 years and older. Even people who have had shingles in the past can get the vaccine to help prevent future infections. The germ that causes shingles can be passed to anyone who has not had chickenpox and was not vaccinated against chickenpox. The germ can cause chickenpox in those exposed, but cannot directly cause shingles. The germ is spread through contact with the fluid from the rash blister and is not as contagious as chickenpox. Shingles germs can only spread after the blister and appear at before the blister from scabs. Now this is by color. The herpes zoster is associated with a decrease in cellular immunity. In Ecuador, the herpes zoster, the estimated risk of it occurring in the population is 30 to 40%. This risk is higher after 50 years old, and 1 in 4 people will develop herpes zoster in their lifetime, and the risk increases with age. For the conclusion, we have that the herpes zoster is a common disease with highest burden in older adults who frequently have at least one chronic disease. Herpes zoster is primarily a disease of nerve tissue, but acute and longer-term manifestations require the multidisciplinary knowledge and involvement in their management.